now, I would like to invite Dean of Graduate School of Public Health, Professor Jong-uk. He will present current situation of Korea related to COVID-19.
I'm Jong-uk. It's a great honor to join this meeting today. I would like to introduce Korea's response to COVID-19. COVID-19 originating in China is now threatening the world. The initial Korean measures were not so good, but thanks to the efforts of Korean government, the public, and the medical community, is now an example of coronavirus protection. I hope that Korea's response so far will help you. We had some technical problems anyway. This is the COVID-19's timeline in Korea. As the timeline shows, there are 4 alert levels in Korea. Level 1, blue, is to watch the situation outside Korea. Level 2, I say again, the level 1, blue, is to watch the situation outside Korea. Level 2, yellow, is when the first case occurred in Korea. Level 3, orange, the regional epidemic. And level 4 is issued when there is a national epidemic. From January 20, when the first case was detected, to February 18th, there were 31 patients in total, which mainly consist of inbound travelers from overseas and their contacts. The first main community infection took place in February 18th after a mass religious gathering. The first main community infection took place on February 18th after a mass religious gathering. The number of cases within a short period of time, with 91% of total confirmed cases found in Daegu. Due to this major infection, the alert level was finally raised to the highest level of 4 on February 21st. From January 20th to February 18th, most of cases were related to inbound travelers, and the curves were pretty much flat. And on February 18th, when doing epidemiological investigation of case the 31st, authorities found that the patient was part of the religious sect in Daegu. The government followed up the intensive testing for the member of the religious sect, and the number started to surge during following days, reaching the peak on February 29th. Since then, we've been seeing a decline on new confirmed cases. After March 20th, the number of daily new cases is around 100. The total number of patients yesterday was 10,000, but only 47 new patients. Here you can see the distribution of confirmed cases. Those in their 20s account for 27.1% of all cases, and the highest. The next is 50s. CFR, case fatality rate on March 27th was 1.49% and 1.9% yesterday. There has been zero fertility from those aged under 30. 1 death each in 30s and 40s. After 40s, the fatality rate increases sharply. The highest fatality rate was seen above 80s with 15.2%. Now these two graphs shows regional and cluster distribution. As you can see on the left, there are big regional clusters in Daegu, Gyeongbuk, Seoul, Gyeonggi. Recently, the number of cases from outside Korea has been increasing. Let's take a look at the distribution of clusters. The religious meeting takes up 54.4% of entire cases. Other clusters include nursing homes, nursing care hospitals, customer call centers, and more. All of these facilities and places in this category are characterized by tight and enclosed space. This slide outlines the government phased response to the virus. On February 23rd, the alarm level was escalated to the highest level 4. They postponed the beginning of schools to March 9th. On February 29th, the Korea showed a peak in terms of new cases, and the government started the social distancing campaign. On March 6th, the government added more COVID-19 protection hospitals and designated in total of 219 hospitals. On March 19th, special entry procedures expanded to all incoming travelers. Now, I'll talk about laboratory testing. Korea has been fully dedicated to early diagnosis through speedy and large-scale diagnostic testing. In total, 357,000 testing has been conducted and on daily basis. Average of 15,000 to 20,000 people are tested. The turnaround time for testing is 6 to 20 hours. This is introduction of Korea response to COVID-19. Now, experts in each field will give you more details. Thank you very much.
Thank you, Dean. And I would like to suggest that the total control of this monitor should be given to here, nobody else, the other side, the touch or operating any control of this monitor, please.